The one hidden diversity, equity, and inclusion issue nobody is talking about. In fact, it isn't commonly seen as a DEI issue. Yet anything that marginalises people is a DEI issue. Some startling facts about medical coverage in the US. Money is the #1 stressor for 7 out of 10 workers. 8 out of 10 employees live paycheck to paycheck. Medical debt on credit reports is $140 billion. And every day, 79 million Americans choose between paying their medical bills and basic needs like food and shelter, despite widespread corporate medical coverage. Since World War II, when company-sponsored healthcare coverage was introduced to American workers, a lot has changed. Except for one thing: company-sponsored healthcare coverage. Employers get blamed for it, HR gets a bad rap because of it, employees look for other employment as a result of it. And it gets worse. Today's company healthcare plans not only aggravate sensitive DEI issues, they fail in this way as well. They fail to give candidates and employees that pivotal factor that makes them want to join or remain in your organisation, a very unhealthy scene for everyone. Because today, it's all about outcomes. Measurable outcomes that employees feel more than any employer's statements or promises of intent, equity, or fairness. Examining the old system used since the Second World War, our founder spotted a major flaw. A flaw not even the best insurance brokers are aware of. A 100% legal provision in the multi-trillion-dollar US corporate health coverage system that few employers and HR departments are taking advantage of. A solution that's liberated forward-thinking HR departments, employers and employees since we made this service available in 2001. Many of your employees are eligible for this plan that every year saves them thousands of dollars, while also saving your company hundreds of thousands or millions of dollars. Your premiums do not change. You don't have to change your existing plan. Our plan is supplementary. You don't have to fire anyone or change providers. Nothing. Here is the simplicity of the plan. Your employee gets full medical coverage. He or she pays $0 deductible, $0 copay, $0 co-insurance. His or her spouse working at another company also pays $0 deductible, $0 copay, and $0 co-insurance. The same applies to their children. Your company goes from paying an average of $15,000 per employee per year to paying an average of less than $5,000 per year. Impossible? Without the knowledge and experience of this legal provision, it would be. These companies thought the same thing. Yet for years now, these companies enjoy employees who are delighted with their medical savings, have a key offer to attract top talent, pay much less in medical coverage, and their HR teams have become heroes. Shouldn't your company be amongst this list? The Second World War ended in 1945. It's time the antiquated healthcare coverage system ended as well. Healthcare for the 21st century employer and employee.